with that, we are going to jump into the Health Informatics Master of Science degree. Dr. Zhao, are you with us?
Yes.
Hi, Ling. How are you
Hi.
this afternoon?
Good afternoon.
Could you give us an overview of the Health Informatics program?
Yeah. So first of all, the Harry actually had a nice explanation about the health informatics and undergraduate program we have. It was that one was actually created and mirrored this master's program. So the master program is actually a more advanced level of the health informatics undergrad. So this is a graduate level, and also we create both the online and the on-campus version of the program. And at this moment, most of our students are online students. And then also have for the 4 tracks. These are for students who with different backgrounds. So like some of our students, they have quite strong IT background. They're like from information science, computer science. So then they strong science background, basically. Then they'll go to the data science track, because then they can really develop health IT systems and also data analysis programs or code. And so they will be the ones who create new tools to do the data analysis. And also we have this general health informatics program. And these are the ones who do not have that strong IT background, but they have some background in science and they know math, statistics. So they can also do analysis, but not like develop new tools or new health IT systems. So then the requirement about those analytics part is actually not that strong, and then we also have some students. They probably have some healthcare background or even other background, and they want to switch to healthcare, and so they probably can go into either this RHIA or the healthcare supervision and management tracks. So for those ones, they will still handle data, but they probably will use existing tools to process the data. But all of them is like to extract information from the data and then apply it into healthcare. And then we also have some applicants. They already have advanced degrees, but they want to have some very specific skills. Then they can go into one of our 4 certificate programs. So like data analytics, cybersecurity, leadership, or revenue cycle management. So some of them, they already have a PhD degree, but they actually apply these certificate programs. And also we can have either full-time or part-time.
And the program also starts every term. You could start in the summer, in the fall, in the spring. There's a lot of flexibility to be had with the Health Informatics Master's degree program. Could you tell us a little bit about the types of students that you see, and maybe we should jump here, but the types of students you see applying to the program? Is it primarily fresh out of undergrad, or primarily professionals looking to advance their careers? What do you see in your student population?
Most of them are working professionals. We also have see a small number of students who just finish the bachelor's degree, but that is not a big number. Most of them, they at least have worked like 1 year or 2 years, or some of them have already worked 20 or even 30 years. But they still want to switch the gear, and especially some of them actually triggered by this pandemic, because they saw how important that information is, and how important it is from to extract information from data. Because there are a lot of data, but then what is the right information? Because that's the media may mislead them. So they actually know there's and then they want to learn more about this data science, data analytics, or health informatics in general. And we have applicants from many different majors, some of them even like music, history, biology, and so that's really a very diverse applicants.
So if we have, let's say we have an undergraduate student who graduates, they go to begin to work, but they're thinking about maybe doing a little bit more. Is this program flexible enough for someone who is a full-time working professional to complete?
Yeah, because this is not just starting from today, even just in the past probably 2 decades. So most of our graduate students are working professionals. So we actually make it very flexible. So then the students will be able to attend our classes. And so we'll also, so for some courses, we offer multiple times in a year. So that if they miss one, they still have another opportunity to take the course. And yeah, all our graduate courses are offered in the evening. And yeah, so that it is very flexible. And we always record our live sessions. So then even if in some situation they cannot attend the live session, they can review the recorded session.
Now, when students are applying to the program, is there anything in particular that helps them stand out? Anything in particular you really like to see in your applicants?
This is actually depends on the specific track they're trying to get in. We actually do not have any prerequisites, but then if they want to pursue like a data science track, certainly it is better that they already have some background in programming, statistics, and that type of courses. Then it'll be very helpful. We have courses to teach them those skills, but just like because we have 12 courses, cannot cover too much. So if they already have that background, that'll be beneficial. So for the RHIA, the similar thing. We also have courses to cover all the requirements for the RHIA exam. But if they have already taken some courses, then it'll be better, but not required.
Okay. And this program really just launched last year. So this is a holistic view of fall, spring, summer admissions in 2020. The program continues to grow immensely. I think that online part-time option is really encouraging and helpful, that flexibility. Let's see. I think I just asked, you know what, I just asked this question. I was going to ask what's, the most important part of the application, but you kind of answered that already. So I'm going to jump over to outcomes. Where do you see the graduates of the program, and what areas are they working? Do you see them changing jobs, or are they just advancing where they are?
Yes, so we say both. Some of them like they're working not in healthcare at this moment, but after it's finished that, they actually sometimes they're just in the middle of they are taking the courses. They have some internship, and then and they start to work in healthcare. And some other ones is they're still in the same place, but they're promoted. And so also then the area has already mentioned that our students really go to many different places, and that is also related to the tracks they are in. Because when they're in different tracks, the training they receive are different, so they can do different types of jobs.
And is there anything else you think the advisor should know about this graduate program?
So I still just want to emphasize is that really the students with any background can apply to our program, and we review them and check to see whether their background fit with ours. And we have seen that the students really it seems that they're from a totally irrelevant background, just like I mentioned, music, but actually they did pretty well in our program. And so that's, I certainly encourage the students to apply to our program.
Great. Now, are there any questions from the advisors in the room?
Whoops, we lost Nicole.
Yeah.
I'll go ahead and finish and say thank you for your time and for joining us. We really appreciate you being here. Thanks so much.
Thank you.